Your typical first aid kit includes band-aids, alcohol wipes, and gauze. But do you know how to use a kit properly? According to a Zip2 finding, 70% of Americans feel they can't handle a first aid emergency. The students explain why this skill is important.
Without first aid, nothing would be done before an ambulance arrives. An ambulance does all of the important stuff like IV while getting to the hospital, while first aid takes care of the immediate problems like stopping blood loss, cleaning the wound, and all that stuff.
You never know what can happen in any type of scene, and so just knowing how to assess a problem and help like kids or even adults like help with a wound, or if they just need time to cool off, it's really important to be able to know how to help them with that.
Also, by 2030, Texas will need more than 6,000 primary care physicians. Here at China Spring High School, students on the medical path are hoping to cut into that shortage. Students in the program will be certified as a nurse's aide and medical assistant by the time they graduate, giving students like seniors Dalton Mulkey and Avery Roberts a step above the rest.
While I study at UTA, I'm going to be possibly working at a nursing home, or maybe with a doctor at an emergency healthcare system, like emergency healthcare place. Would these programs allow earlier or newer generations to get into the field much quicker? Instead of going through college and getting this CNA by themselves, which would take a longer period of time because it's self-learning, this would allow them to get in quicker because they're having help and they're doing this daily, the daily thing, not at your own pace.
I am hoping by the time I get my CCMA to get a job at some sort of hospital and just be able to get that experience before I go into my lifelong work.
Very cool. And what's your lifelong work?
Hopefully either physical therapy or oncology, or just combining those two and be a physical therapist for like cancer patients.